ago now. I can't remember now, but this was one of the main topics, of course, at the General Assembly of the World Health Organization, where people want to know the pandemic, that thing that happened just a few years ago, did anything come of it? And it's hard to believe, but there was that moment when the world was really coming together around this idea of solidarity, but it was so fleeting, wasn't it? And we very quickly learned that actually countries will do what's best for themselves and maybe not what's best for global health. And one would think maybe we got some lessons from that could lead us forward. That's a bit of what we're going to get into today if we can. But let's maybe just start with level setting, if we could, with Eloise Todd, who is the founder and executive director at the Pandemic Action Network in the UK, because you follow this closely. You've worked a lot on this pandemic agreement. Maybe just level set for people here and those following along online as to what is this agreement and where does it stand now that we've had the World Health Assembly a couple of weeks ago?
Thanks, Raj, and it's a great honor to be here today. So here we are, June 2024. There's been 2 years of negotiations, and quite honestly, in recent months, it was looking like the entire project might evaporate into thin air. So as we were getting closer towards the World Health Assembly, there's a lot of nervousness, a lot of late nights, and a lot of negotiations, and various forces intervening to potentially upend progress. The good news is twofold. Number one, the international health regulations, a bedrock for international cooperation for future public health threats, actually got agreed at the World Health Assembly, so that's great. And then the second...
And that's a big deal, right?
It's a big deal.
That wasn't a foregone conclusion.
It wasn't at all. They were last updated in 2005, and so this update of them really sets the stage for a strong legal basis for global cooperation. The pandemic agreement, however, lives to fight another day. There has been an agreement amongst all the member states to have an extension of up to 1 year, so hopefully to agree this by May 2025 at next year's World Health Assembly, or there could be a special World Health Assembly to agree if agreement is felt to be in the air earlier, and there'll be a modalities session in July, which means they'll organize how they're going to approach this, and there's certainly lots of different ideas about how to approach the negotiations, potentially a bit differently from before, and then negotiations will start in earnest after the UN General Assembly and into next year. But we did see some disappointing geopolitical rifts, shall we say, despite a lot of the rhetoric during the COVID years that we heard that no one's safe till everyone's safe and we need to work internationally. Unfortunately, we didn't see that kind of solidarity from a lot of the groups. I think one of the positive things to note is the strength and togetherness, most of the time of the Africa group, and also of a group called the Equity Group, which consisted of many different low middle-income countries, really kind of putting a challenge out to some of the more traditional negotiating blocs.
Yeah, there is kind of a block or a couple of blocks forming based on the experience of the pandemic. And that experience has informed many countries that if they don't fight now in this agreement for their place at the table and for a more equitable system, then when there is the next crisis, they will be once again left behind. And maybe that's a good point, if we could, to bring in our next panelist. Pardon me, I'm dropping things. Magda Robelo is with us, and Magda, of course, is the former Minister of Health of Guinea-Bissau. So you've seen this up close. Maybe you can talk to us a little bit about this idea of health equity, about what the pandemic agreement is trying to get at exactly, and how you see it from the perspective in the global south.
Thank you, Raj. One of the good things about the Paris Peace Forum is that it gives you a broad perspective about what's going on around the world. And if you listen to the discussions this morning on agriculture, on energy, etc., you could see similarities with what the pandemic agreement discussion is all about. Those who are at the receiving hand and not able to afford the transition goods that we need today, and those who sit on the resources and the capital, the knowledge, etc., and our reluctance to do the necessary reforms that will make the world a better place if we all could share a little bit more of what we have. So this is what the pandemic agreement is all about. It's about the inequities as we see with climate, as we see with so the energy, the green energy, etc. Those, the global north, being reluctant or even stubborn, if I may be politically incorrect, to agree on measures that will make us safer globally than we are today. When the COVID-19 pandemic happened, we thought that lessons have been learned, and then when it came to discussing the agreement, there will be some give and take that will put us in a better place, but that is not happening. So equity is, for us in Africa, the cornerstone and the most important element for the pandemic, and we'll continue to fight for it. I'm happy to hear Eloise echoing something that I think was really good, the African group being together and negotiations. From the country level perspective, I think what I see is continued underinvestment in what is needed to strengthen prevention, preparedness, and response for outbreaks and pandemics. I'm not even talking about pandemics, just outbreaks. We have seen how cholera swept around Southern Africa recently, and we have seen that we had many people die. So we don't even need to wait for the pandemic. We need to invest more on systems for preparing, responding to adequately. We need to have less inefficient and less fragmented investment. When I say underinvestment, I'm not saying no investment at all, but what is being invested is so ineffectively done, is so fragmented that we end up not having the outcome, the added value that one would expect it to.
Because they're not investing in your health system, they're investing in specific projects or verticals, right?
Exactly. You'll see a single country with 40, 50 different data sets that don't talk to each other because they are sponsored by specific donors. And there is no way you can strengthen surveillance systems if you do that. We don't still have the research and development capacity that we need to be able to deal with specific issues that arise from our own continent. It is hard for you to have a cholera outbreak in Europe, but we have cholera outbreaks, so we should be able to deal with our own issues. We should be able to produce the vaccines that we need. We see that it's not just COVID-19 vaccines, but a range of other medicines and vaccines. So equity at the center, being able to share the benefits of innovation, development, and discoveries that are made, and making sure that everyone understands that until we are all safe, no one is safe. Of course, politics matter, and we have seen the outcome of we are seeing the unfolding of the European Parliament elections. So we are waiting to see what is going to happen in America. So all this is still to be seen, what will happen with the pandemic.
It's all very much connected. And there's many things you mentioned I want to come back to, but I want to bring Anthony So into the discussion if I can. Anthony is a professor of practice at the Johns Hopkins Bloomberg School of Public Health. And Magda referred a little bit to health technologies and innovation and this issue of access, right? Which is a long-running issue where innovations might come from the global north, they might be invented somewhere, there's intellectual property protections, there are businesses and markets built around them, but maybe the burden of disease is actually elsewhere in the world at very large numbers. How do you think about this question of access to innovation and health technologies today?
I think I can pick up where Magda left off, which is the fragmentation of the pharmaceutical value chain, the disparity actually and asymmetry of globalization, where in fact, of course, the expectation of the life-saving products crosses borders, but the products lag behind. And importantly, she also raised the need actually for us to be able to deal with this both in pandemic and non-pandemic times, in between, as in cholera actually illustrates. And we need a fit-for-purpose research R&D system to do that. And I believe we can do so actually, and the elements are coming together, but we're going to need a framework to really make that a coherent, resilient system. And that means really investing and envisioning an end-to-end approach to our pharmaceutical R&D system so it delivers actually with an eye to health equity. Now, I think we can do that because there are elements for adjusting the three key flows that go through our value chains. The flow, for example, of particularly products, and the flow of finances, and the flow of information. If I might just perhaps elaborate a little, the flow of the flow of products actually obviously has a lot to do with the emerging debates over where do we localize the production of particular vaccines. Africa sourced 99% of its vaccines from outside the continent. But if we could actually build local manufacturing facilities and support them, and we're beginning to see some of that with PEPFAR committing to invest also in diagnostics, like HIV diagnostics, they're going to buy 15 million such tests by 2025. If we see also the Global Alliance for Vaccines Immunization, or Gavi, will be launching with the support of the French government, I believe, the African Vaccine Manufacturing Facility Accelerator. But we're going to really need to move upstream, because if you want to build capacity in Africa, we need to start building things like the mRNA technology transfer platform that WHO is involved in, with Afrigen in the lead and a number of other, of course, groups around the world. But then the question is, we need to then have the financing follow. And the financing in some ways must enable actually this kind of system. Because in order to have local production, you also need to have regional health security. Who's going to assure the equal allocation? Because Africa may get 5, perhaps according to the African Development Bank, vaccine manufacturing facilities among 54 countries on the continent of Africa. So we need to have actually a pool procurement facility that uses the power of public sector buying in a way that enables actually equal allocation across countries. And then finally, of course, information, which is the most critical. Access and benefit sharing for the innovation side must be, of course, advanced. And we have, of course, the pandemic influenza preparedness framework. We have, of course, the COVID-19 technology access pool that will become the health technology access pool. And on the access side, we need to, of course, stop this sort of situation where the health justice lawsuit in South Africa highlighted that, in fact, bilateral contracts between companies and governments have hidden, in fact, what the real price has been. I mean, we learned that actually South Africa paid more per unit dose for COVID-19 vaccines than the European Union, and that they were precluded even from actually retaining those actually vaccine doses that they filled and finished in South Africa and had to export them to the European Union even when their local needs were not met. These are the kinds of transparency and access issues that we need to grapple with for flow of information.
It sounds like you're talking about something that isn't new to global health, and that's market shaping. But you're talking about market shaping on steroids, right? Like the original ideas around market shaping were often a drug that already existed, but the formulation might need to be different for the global south. Is there a way we can put up enough of an advanced market commitment, plan to buy a lot in order to drive the price down? You're really talking about an end-to-end value chain where the market has to be shaped by philanthropy, by government, by regulation, by private sector, and that's a hard group to stitch together.
But to be clear, we have begun this process over the past quarter century. Product development partnerships have begun, in fact, to stitch that actually pharmaceutical value chain together, from R&D to actually access in countries. We still need a lot of work, of course, at the tail end for scaling up these commodities as the fruits of that investment from over a dozen product development partnerships comes to market. But importantly, we need to, in some ways, also look to other sectors, which I think is one of the great advantages of the Paris Peace Forum, is to see the lessons from other sectors. For example, for crops, we have the International Plant Genetic Resources Treaty. They, in fact, do not have the same kind of barriers. They have a decentralized network of gene banks. They share 64 crop average varieties. They do so actually under a system whereby if you use it, you can, for R&D, it's free. If you use it actually and get commercial gain, you pay to actually support the system. That's a compensatory liability system that you use first, you pay later. If they can do it in crops, why can't we do it in biomedical products that actually save lives as well?
Maybe that's a good follow-up to bring to you, Magda, because you referred to what Anthony's just saying now, and that is that we can draw some parallels to the other just transitions that we're talking about at this event. Well, one of the other parallels is critical minerals, you mentioned, and when I think about many of the countries in this region that have critical minerals, that gives them some power in that relationship. When it comes to health, it seems like the power is with pathogen data. It's with surveillance data. It's with, there's an outbreak in your country, Guinea-Bissau, and you decide to share that with the world because other countries therefore can be prepared and see what's happening. Are you prepared to say, or should the African bloc that is negotiating this treaty be prepared to say, if we don't get agreement on the other elements of this that make a more equitable system, we're not going to share that data anymore? Because ultimately that is the stick, right? There are plenty of carrots, but that is the stick. Where are you on that question?
I discussed this with someone from a pharmaceutical company who told me, well, it is just a matter of time for that pathogen to circulate and get to us. So we don't need to give on something that is so critical for us. This is the answer I got. So we also need to know that the pathogen is not the only thing that is at stake here. I was just reading some data, 60% or so there of health workers from one single country are moving to one single country from Africa, moving to one single country in Europe. So this capacity is also critical. And let me say two things and then I will stop. One is about localization. I don't quite like the word localization. To me, it looks like you go to Singapore or to any other Asian countries, you produce your vehicle parts, the cell phone parts, and then you assemble them, you bring them to where you want to, you ship them to where you want to go. Localization to me is not what we need. What we need is producing in Africa with all the regulatory, intellectual property, technology transfer that is needed. And there is a lot still to be negotiated through the pandemic agreement. So we don't want just a cosmetic way of building plants in Africa and then pretending that we have localized. I'm seeing decentralization of a lot of officers, etc., and then people are calling that localization. There is power that needs to follow that. And if power remains somewhere else, then we are not really talking about localizing and shifting what needs to be shifted so that there is a more balanced way of negotiating and going about things. Then the final thing I would like to say is that the responsibility is not just with the North. We have huge responsibilities in this equation, and Africa needs to get its hearts together. We cannot think that all the solutions will be brought to us from somewhere else. We need to bring the excellence in leadership that will bring fair transition to the continent. I will stop here. Thank you.
Yeah, so you're talking about a much more significant shift, right? A really systemic shift, as opposed to, we've heard some announcements from some pharmaceutical companies, we're going to open a vaccine facility here. We're going to open a vaccine facility there. And it does feel a bit like a check the box that, look, we've done it, therefore we have done our part when it comes to equity. You're asking for something a lot more fundamental than that. I want to come to you, Eloise, but I also want to alert our audience here. If you have a question, I'm going to come to you in a moment. Just raise your hands, and we'd love to get any question or comment or feedback on the panel going. But Eloise, to bring this to you, you were listening in part of these discussions. I noticed, by the way, you're using the word, and many are, agreement, as opposed to treaty or accord. And it seems like part of that is the politics of trying to suggest, don't worry, this is not something that's going to have as much enforcement potential as a treaty might. And yet, we're hearing from Magda, she wants this thing to really change things, right? And she wants it to be enforceable. So which is it, and where are we likely to land?
Thanks, Raj. Just at the outset, I'd say, unfortunately, we weren't listening in to the negotiations because CSOs aren't actually allowed in the room. And this is highly unusual for many UN negotiations and something that we are competing for and fighting for all the time. So just wanted to make that point. In terms of the politics of is it a treaty or is it not a treaty, it's definitely an agreement because apparently that is the better word to use and everyone feels very relaxed about it. So let's keep everybody very calm and call it an agreement. But it does, Magda is absolutely right. We absolutely have to have an agreement that means something. So we're delighted we have a chance to help cajole from the outside, not in the room, unfortunately. But we absolutely need to make sure that it's worth its weight and more when we get to it. And I think this point about connecting the dots and the importance of Paris Peace Forum and this fair transitions work, you know, this is all connected. If we remember, if you cast your minds back to March, April 2020, that terrifying time when none of us knew what on earth was going on, where the solutions were going to come from, leaders were making, in some cases, quite crazy decisions, and people were going in all sorts of different directions. That was political leadership, power, sometimes misdirected. But we have to put ourselves in that place again, and leaders have to put themselves in those shoes that in some cases they filled at that time, in some cases it's new leaders. But when a pandemic threat occurs, it becomes the most political issue that there is on the agenda. And until and unless we've got leaders taking it as seriously as that for this pandemic agreement set of negotiations, we're not going to get to the kind of results that we need to. So there's a weird kind of amnesia that's taken place because of the difficulty of the COVID period that we have to get over.
Isn't it almost worse than amnesia? It feels like it's become so politicized that in many parts of the world, it's actually the conversation has gone backwards. Right? It's not just that they're forgetting that there's a pandemic and what a pandemic can mean, but they're actually actively disputing the history of what happened and blaming some of the organizations that were key to resolving the crisis. So it seems politically like we're in even a more difficult position than amnesia would suggest. What do you think?
I think that's right. I think there's a lot of leaders that haven't been first in line to want to look closely at what went wrong, because a lot of leaders didn't do great in their own country, all over the world. A lot of people lost their lives from early mistakes. So we haven't had that kind of accountability set of moments in a way that you would perhaps usually expect when so many people lost their lives. The official number is 7 million. It's actually more like 20 million when you look at excess death figures, etc. So we're in this unusual situation where the whole bedrock for the current financial crisis, the whole bedrock for a lot of the conflict that's taken place, was sort of rooted in the pandemic isolation and the pandemic economic impact, and yet it's the piece that gets dropped. And I just wanted to make the connection as well with the finance piece. It's so important that we get the investment in the end-to-end finance, that the value chain that Anthony has been talking about and Magda's been talking about. And we have to connect the dots with the climate finance conversations going on at the IFIs, with the reform conversations that are going on. These are not just about, the mitigation piece is absolutely essential. Well, 5% of emissions come from the health system, so let's start there. But let's also build the resilient, nimble systems of the future that we need in 2040, 2050 and beyond across the world. And that's going to need massive investment in the kind of R&D and manufacturing to also kickstart different kinds of economic growth in all of these places. So actually, if we can link health, climate, pandemic preparedness and finance in a more meaningful way, we'll start to see the political endeavor and see the political importance of all these issues, and perhaps get the kind of political attention that we deserve for the pandemic agreement. And
like climate, prevention ought to be financeable, right? When you think about the costs that will come if we have another pandemic, or what we spent on this last, even beyond human lives, what we spent just financially, you ought to be able to finance that prevention in the same way that the climate community is pushing to finance the energy transition. And maybe using that analogy, Anthony, I can get you into the conversation around the role of pharmaceutical companies, because you've mentioned them, Magda's mentioned them. We don't have a pharmaceutical company representative here, so I want to sort of ask you to channel a little bit of what you would like to see from them. I look at the climate movement, which really decided that fossil fuel companies were playing just a bad faith game. And I think in many cases the evidence shows that's true, they were. But yet there are some fossil fuel companies now that seem to be in the debate, that are part of the conversation. Where do you put the pharmaceutical industry? It's so essential for the innovations that we're all talking about. You want them clearly part of the system. they are actively fighting a lot of the elements of the agreement that certainly Magda wants. Where do you see common ground?
Well, I think it's important to consider that the pharmaceutical industry is a heterogeneous, actually, group of industries, really. You have a generic, and you have, of course, a brand name originator set of companies, and of course, you have across different, also, the technology landscape, those involved in vaccines, drugs, and of course, diagnostics and medical devices. And it plays out a little bit differently in some of these areas, because the distance, really, from the starting point to the market deliveries can be quite different, as well as the costs involved. One thing for sure is that we are unfortunately not going to be able to sustain, say, the kind of pharmaceutical innovation at the cost of $1 to $3 billion, say, for a new antibiotic. That is simply not going to be very easy to make those kinds of products available to the global market in a way that actually will be reachable to all those, unless there's a huge decision to subsidize in tiering prices. And I don't think it's forthcoming, and we certainly didn't see it, actually, in many other areas. So importantly, I think we're also going to need to think about how to also remove the financialization, frankly, that we see in big pharma or the large research-intensive companies, where in fact, for example, the first 10 companies in the United States ever to be subjected to Medicare price negotiations, so it's been decades before we actually got to this point in the United States to actually negotiate with our companies over prices, in fact, spent $10 billion more on the C-suite actually enrichment activities, things like stock buybacks, compensation for executives, than they spent on R&D in 2022. This is a public citizen study, and it's been also, of course, documented by other people like Mariana Mazzucato and Professor Lazanik as well in this area. So we're going to need a different model for pharmaceutical innovation, and that includes a lot of the important work that's being done by small and medium enterprises. If you look at the WHO's analysis, for example, of the antibacterial pipeline, most of the early product development are done by small and medium enterprises, many under 50 employees. We need to find a way in which to enable them to bring actually their products to first in human trials, and then pass the baton to pooled procurement facilities and others who can carry it the rest of the way. Amazingly, in the United States, we're beginning to see this also happening. Our own actually private sector has created a nonprofit generic company to bring pharmaceuticals that are in short supply, they're expensive, to actually market. CivicRx, involving nearly 30% of the hospital beds in the United States, has created a nonprofit pharmaceutical company that will contract or even build manufacturing facilities, as they've been possibly doing with California, to actually bring low-cost insulin. But the first two actually drugs they brought to market, interestingly, were daptomycin and vancomycin under contract, two antibiotics. And why is that so important? Because sometimes the business model doesn't work as in antibiotics. You sell more, actually, you drive more resistance. The biology and the economics and antimicrobial resistance doesn't work. It's these areas that allow us the opportunity to innovate better. And I think it's this integration of that end-to-end between actually the upstream R&D that is largely publicly financed, and the downstream, of course, actually delivery, that we're now seeing new innovative approaches from pooled procurement facilities, UNICEF, PAHO's revolving a strategic fund, Africa's efforts to build pooled procurement facilities, that we need to bring together because we can build a system better.
Yeah, the pooling is really important, and that kind of gets back to your earlier point about the African countries coming together as part of this pandemic agreement. It can't just be coming together diplomatically. It has to be coming together regionally to say we're going to buy, or we're going to stand up a vaccine manufacturing facility in this country, but we're all going to share the market for that facility. So it really is kind of an in-depth operationalizing of these ideas that's required, and that's not easy, and that's not going to be quick. At the same time, we have an ongoing global health system. This is a year of many replenishments of a lot of the global health initiatives that are out there, a lot of the vertical organizations you referred to, Magda. How do we sort of get from where we are today in global health to the vision that Anthony and you have kind of sketched out, which is a very different world than the one we live in now?
We live in a world that is radically different from the one immediately after the Second World War, definitely. But we have this responsibility of forging a world that will bring us closer together. It is hard to do. It is not going to happen tomorrow, but we need to plant the seeds for it to happen. I think if blocks get into working together to agree on certain things, the free trade zone in Africa needs to come to reality if you want the supply chain to work. It may look far away, but it is part of that. So Africa needs to work within the continent to make sure that we can trade among ourselves.
And there's been
otherwise.
some progress on that, and you've got the African
But not
Medical
fast
Regulatory
enough.
Agency, right? There's moves in this direction.
There are movements, but we need to work faster. Only 28% of health facilities on the continent have electricity. So energy is also part of this equation. We can't fast track response, prevention, and preparedness without electricity and without digitalizing our systems. So it is all interconnected, but blocks need to get together. There is a partnership that was born out of the Caribbean and Africa collaboration to strengthen South-South collaboration. That will take us forward. And at the same time, building the bridges that were broken or are still being broken between global north and the global south. It is hard, but I think we can get there if we work harder.
Yeah, this will be, I think, one of those key moments when the global south will say, okay, trust has been broken, but we will see now whether trust can be somewhat rebuilt. There's just as good of a chance that this pandemic agreement doesn't necessarily come to pass, right? It's not a foregone conclusion. What do you think, Eloise? You're working on this every day.
Well, I think we've got a really good chance of getting it through because it really was under huge pressure in the last few weeks. And I think if it was going to sink, that was when it was going to sink. I think now...
The patient survived that critical period.
The patient survived that critical period and hopefully now into recovery and getting stronger all the time. A lot of progress was made in a short time. It's not to say that, you know, some of the thorniest, most difficult issues are there. I think it's also incredibly important that civil society and people that have the same vision of the world where countries can deliver for their people, can deliver for the most vulnerable wherever they're born in the world, come together and actually get involved and push for the right kinds of policy changes for the pandemic agreement, both nationally and internationally. And we have a year now to do that. So if anybody is interested in that fight, please seek me out. We really need the support. The Pandemic Action Network is very much looking to deliver or help to deliver from the margins, should I say, a world in which there is equity, a world in which every country and every community has the ability to prevent pandemics prevent outbreaks from becoming destructive pandemics.
And if I may add to that, just to highlight one of the challenges of these negotiations, women are 70%, sometimes 80% of the health workforce in the health workforce, and it was hard to agree to have gender included on the terms of the agreements. It was hard to have women written, agreed upon as to be protected and critical. So even around those blatant issues, the world is sometimes so far apart, and we need to continue working hard. An agreement is possible, but we need to continue working hard together. Then I will not be happy with an agreement that doesn't recognize that we are the driving force of the health sector.
I'm looking to see if we have any hands for a question. I'm not seeing one. Oh, here we go. We have one there. I don't know if there's a microphone that can come to you. I think so. Here in the middle, in the blue suit. And just if you would tell us your name and organization. Go ahead. It should turn on its own.
Hello, I'm Dr. Dick Chamla, and I'm from WHO Afro. I'm the head of emergency preparedness. And it is great to see our Rubalo here in the high table. It's a long time ago. Actually, it's really excellent to hear us. We are talking about pandemic accord. I think a number of us were started the process 2 years ago. And if you see, the original text has really changed now. Although our Africa group at that time, we are preparing it, we agreed we will have areas in which it will have obligatory language and other areas in which it won't have an obligatory language. Actually, in the INB 9, actually, original text has really changed now. And as a result, it is really lenient text. The problem in which I have now is the issue of compliance and implementation of the accord. And actually, I didn't hear it here a lot. So we have issues of resources, actually in the world, and a political landscaping is changing now. Actually, we had election in Europe, so we will have election in the United States. And we hope it wouldn't have any impact actually in the agreement. The question is, how do you really see the changing in election and the resources problem it will have an impact in the implementation of the pandemic accord? Over.
Thank you very much. And maybe, Eloise, I can bring you in on this question.
Yeah.
We talked about it a little bit with the naming. Will this thing have teeth, and will it get funded?
So really important points, and accountability and financing, along with equity and gender and One Health, are kind of 5 of the foundational pieces that need to be resolved for this agreement. And what we're looking, on the accountability side, we're looking for a COP-like process, really, for pandemic preparedness, that you have that annual accountability, that you have leaders coming together. You're right to say that that was stripped back in the last version, but we do have a year to go, and we will be fighting for that all the time. On the finance piece, you asked about what the elections mean for this. Now, we've had very shocking elections, particularly in some particular countries in Europe. Obviously, a big shift in France, also in Belgium, and in Germany. If you look at the bloc of the European Parliament, the blocs in the European Parliament, and the actual makeup of the main political groups, the big hits, the Greens and the Liberals have gone down a lot, but the main 2 moderate blocs, the Socialists and Democrats and the centre-right bloc, have actually not changed that much. The reason I'm saying that is I'm not sure that hopefully the makeup of the European Parliament won't have a huge impact on the approach regards all the issues that we care about, we've been talking about. However, I will say, even in the last mandate, in the last Parliament, it's incredibly difficult to get any money because there's just none left. And the resources that have been going to Ukraine, the resources that were taken for COVID domestically, just mean that we have to be ever more creative about where any of these monies come from. So I think we need a much more innovative approach. There's some exciting things like Macron's Commission on International Taxation, for example. We have to think differently about where the money is going to come from for this. I'll say again the point I made earlier about the international financing institutions. Some things that need to be precious grant funding, but other things can be low concessional loans, for example. And we have to think about, yes, climate, yes, absolutely important. Also, how do we invest in the economic future for low and middle income countries and for pandemic preparedness globally? And what can we do with that, with all the opportunity that's there? So finance is essential, accountability is essential, and really important parts of that work going forward in the pandemic agreement. But I do think we have to more broadly be very creative about where the money is going to come from.
We're running out of time, but I want to give everybody a chance to take us forward. This is an ongoing project, getting to this agreement, and maybe even goes beyond this specific agreement. Certainly your vision for this, Anthony, seems to go beyond just what this pandemic accord could do. So close us out with your thoughts about where you think the global health community needs to take this agreement and even more broadly.
There are a host, of course, of challenges that face us today that are infectious disease threats. They're not alone, of course, with non-communicable diseases, of course, looming large as well. I mean, COVID-19 pandemic is like a tsunami, but antimicrobial resistance is like a rising tide. And the reality is we're going to have to deal with both in pandemic and non-pandemic times. In my mind, we need to actually commit as a global community to really clear targets, ones that we can also support in a way that actually is conceptually possible. Because these multi-billion-dollar actually requests don't really fall on ears that are listening. So the question is, in some ways, can we frame it differently? And I would suggest that we could actually, like we are thinking about in antimicrobial resistance, let's think of a comprehensive package. But as in the OECD actually had suggested, a $2 per capita investment into AMR, comprehensive investment, not just drugs particularly, but diagnostics and infection prevention control, could actually save 47,000 lives in OECD countries, pay itself in under a year, and in fact return actually billions of dollars, $4.7 billion actually each year as well. So the question is, can we actually create that kind of a package and sell it as a social vaccine? In my mind, this goes to some of the issues surrounding actually if we're going to have measures and mandates, there has to be some way in which for people actually who are resource limited to be able to comply and follow and do it in their own way. Not just the way actually that we might actually in the north where there's different infrastructure. So those are the important things, and financing I think can be done if we can just in some ways consider some of these new approaches and take an end-to-end approach to actually integrating where we're actually putting public sector monies now. We pay for almost all innovation, up front for an R&D and out back when it comes to market. We should be aligning that work more effectively for the public interest of all the world's people.
Magda, any final thoughts from you?
I think it all boils down to how do we harmonize, align, and cooperate. We will not find health solutions if we don't work on the economy, climate, and all that. Just to insist on maybe one way of increasing money at country level, there is a huge proportion of people in countries that are doing out-of-pocket payment, very expensive payments for healthcare when they fell sick. If only governments could get organized to use that contribution in a shared way so that people can prevent the out-of-pocket expenditure and get access to the care they need, you will see much more resources in countries to take care of some of the costs, and will be able to use additional money differently. The second thing is the global health initiatives that really need to come together to reduce inefficiencies, align, harmonize with country priorities. So here the Lusaka agenda is an important entry point for that to happen. And finally, to say that universal health coverage through primary health care should be a critical principle within the agreement, and that's the way we will be able to make sure that people are protected health-wise so that they can lead healthy lives, and then we'll be able to benefit from all the minerals that we are endowed with. Thank you.
Thank you. Eloise, a final thought?
Yeah, we have about a year to make sure that we do get a pandemic agreement with teeth that can actually help everybody, wherever they live, to survive a future pandemic threat. This is really important for multilateralism. It's a really important test of whether the world can come together post-COVID and deliver that in really difficult times. And it's also an effort which is being attacked by the kind of forces that saw climate denialism, that have seeded conflict online. There is a disinformation campaign now against the WHO and against the pandemic agreement that is going to need to see us run even faster to stand still and to make progress. So join us, join the fight. It's really important that we deliver this for multilateralism. Thank you.
We've heard this comparison to the climate space many times in the discussion, and you're right. And what the climate space has really is a movement around the world of people who are pushing. It's just as complicated. There's just as much backlash. It's just as challenging, but there is more of a movement. And it sounds like, listening to the three of you, we have a vision for where we want to go, and what we just need is the movement to get there. So thank you to the Paris Peace Forum for putting this panel together and bringing it to this stage. And please join me in thanking this fantastic panel. Thank you. Thank you. And I'm going to stay up here because we have another session that is about to begin. We'll just ask our panelists to exit the stage.